Thank you so much for joining us. I'm Ralphie Aversa with the USA Today Network in for Megan Finnerty, and this is Just the Facts Live Coronavirus Conversations. I'm coming to you live from the apartment that my girlfriend and I share here in Midtown Manhattan. And it's funny, I get a lot of questions from friends and family, what's New York City like these days? And there's definitely less traffic. It's definitely noticeably quieter. But one of the cool things, and maybe you've seen it on social media, every night at 7 o'clock, everyone stops what they're doing and they cheer on those who are on the front lines fighting this pandemic. So I have to say, while our streets are a little emptier, our hearts here in New York are just as full. Today, we'll be answering your questions, and our viewers and USA Today readers have sent in a lot of them, over 14,000 to be somewhat exact. We'll answer the biggest ones here on Just the Facts Live. Questions from antibody tests to masks to what you should and shouldn't be wiping down. We'll answer all of these questions with the latest information that we have because, as we know, facts fight fear. USA Today's news that's meant to be shared. And I'm sure today we'll be answering questions that you, not just you, but your loved ones as well, will want the answers to. Sharing this information with them is as easy as clicking share on this video. Without further ado, we'll introduce our guests who will be joining me today on Just the Facts Live. Two reporters from the USA Today network of over 5,000 journalists, breaking news reporter Grace Hauk and health reporter Adriana Rodriguez. Also joining us from Houston, an assistant professor of tropical medicine and infectious diseases at Baylor College of Medicine, Dr. Jill Weatherhead. Dr. Jill, Grace, Adriana, thank you all for joining us. And let's get right into this because we have a lot of questions that people would like to know the answers to. The first one, and an article just came out about this actually on usatoday.com. Can you disinfect the virus from a mask? Grace, we'll start with you.
Yeah, so as you mentioned, Ralphie, we have a great graphics explainer on this topic. Many of us have this question, and that really depends on the type of mask that you have. First off, do not try to bleach your mask or cover it in Lysol. You would put yourself at risk of inhaling very harmful chemicals. So if you have a cloth mask or maybe something you made at home, the best way to disinfect it would be to put it in the washing machine, or if you don't have access to a washing machine, wash it at home with just some soap and water. If you have one of those face masks that you can't really wash with soap and water, put in the washing machine, one of the surgical face masks, you can put that in a brown paper bag and set that aside for a couple of days. That's enough time to kill off the virus. If you do happen to have an N95 respirator mask, many of us don't have more medical grade, you could put that aside in a brown paper bag for 7 days, and that will also have the same effect.
Grace, you keep mentioning brown paper bag. I want to bring in Dr. Jill here. Does it have to be a brown paper bag? Can it be a plastic container? Is there a difference? Why the specificity there?
Yeah, that's a great point to make. It's really based on the limited data that we have about how long the virus may live on different surface types. So more breathable surfaces like a brown paper bag is going to be more available to get rid of the virus than something like a plastic box or a plastic bag that won't be as breathable. So at the current time, recommendations are to put it into something like a brown paper bag that will allow the virus to be killed off and not stick to those surfaces as readily.
Okay, so short answer, the answer is yes, depending on the mask, then it kind of varies from there. Let's go to the second question here that we'll be answering. Should I be wiping down everything with bleach? Adriana, there's been a lot of talk about this, whether it's different surfaces coming from different locations. What's the general rule of thumb here, Adriana?
Yeah, so basically when we get reader questions like this, we always hear either one or two things. Either should we be wiping down our mail or wiping down every grocery item that we bring into the house, right? So let's start with mail. Usually most mail packages are cardboard, and cardboard is more porous, right? So that means that the virus can penetrate that surface a little more deeply so that if you just wipe it off really quick or something like that, it just won't work that way. So really the basic answer is no, you don't have to wipe down your mail every time it comes through the door.
What about groceries though?
Groceries. So we're talking about surfaces, right? We're talking about cardboard versus plastic and whatnot. The general consensus, like among experts, they tell me that you don't need to be wiping down every single thing that you bring into the house, that it's less likely, the virus is less likely to be viable to infect people on the way to the grocery store, on the way to your house, you know, all that interchangeability and all that time that it passes in the air, it's less likely to come into your house and actually infect you. So the general consensus there is also no, you don't have to be wiping down everything that you take into the house. However, I have heard a lot of people push against this idea. So I do want to say that it's also not harmful for you to do so. If you feel safer bringing in things and wiping them down, then that's fine. The only thing that I advise against is using any kind of soap or disinfectants with produce and vegetables, because that can harm you if you ingest them.
Yeah, I will say, to be perfectly honest, in this household, when I go grocery shopping and I come back, usually the cans and some other things are wiped down. Dr. Jill, I guess if that makes me feel okay still, it makes my girlfriend and I feel okay, we should continue to do that, but it's not necessary?
Yeah, I agree with what Adriana is mentioning. So it's important that we remember what we know right now, the main mode of transmission is through close contact from those respiratory droplets. You can get it from touching contaminated surfaces, which could mean grocery store cans or whatever you're buying there, but the likelihood is going to be much less than if you're in the grocery store in close contact with somebody. So again, it comes back to how long that virus stays on a particular surface, but also, is it even possible then to transmit that virus from that surface to infect a new person? And that's going to be much less likely than in close human-to-human contact. So I agree with Adriana that it's not necessarily required, but if it makes you feel more comfortable, then that's completely fine as well. I would also, however, emphasize that washing your hands after coming back from picking up your mail or after coming back from the grocery store and putting away your groceries is recommended.
Yeah, that's an excellent point as well that shouldn't be forgotten as we talk about wiping things or not wiping certain things down. And again, I'm sure some of your friends, some of your family, if you're watching right now, they are doing this. Maybe they're not doing this and you want them to do this. Regardless, you click the share button and you can put it onto their news feed as well. Let's go to the third question here on Just the Facts Live. And that's, can cats transfer the virus to humans? Grace, what do we know about this?
So we've been getting a lot of questions about pets. Can they be sick? Can they transfer the virus? From what we know now, and this continues to evolve as we learn more about the virus, cats and dogs cannot transfer the virus to you, but you can transfer it to them, and they may be able to transfer it to each other. So we had reports that 2 cats recently in New York State were actually symptomatic, were having respiratory issues, they tested positive for the virus. One was living in a home where other members of that family had already tested positive. One was living where no one else there tested positive, which seems to suggest that the cat may have picked it up elsewhere and hadn't been able to transfer it to that family, but that could change. We had a story out today actually about how a pug living with a family in North Carolina was also symptomatic and tested positive, and members of that family were also sick. So yes, it is possible for you to transfer it to them, but CDC, FDA, other health experts at this time say there's no evidence yet that your pets can give it to you.
Grace, you know, we prefaced the start of the show by saying we're going to answer these questions with what we know now. What we know now about this is different from what we were hearing in the past about this from the CDC, right?
Right. So at the end of February, I reported on a story out of Hong Kong that a couple pets had tested positive, weak positive was the terminology they were using at the time for the virus. And health officials in Hong Kong were saying that they suspected there was some sort of environmental contamination, that the pet somehow picked up some sort of substance or surface that had the virus on it, and that's why they were testing positive, not because they had actually contracted the virus. But now the new evidence seems to cast some doubt on that claim, because some animals are actually being symptomatic for this, and it's not just this environmental contamination that we suspect the pet has rubbed up against the virus in some way. And so at the time, in end of February, WHO was saying, we don't think that pets can have this virus, there's no evidence, and now they've walked that back.
You're watching Just the Facts Live Coronavirus Conversations here on USA Today. I'm Ralphie Aversa in New York. Okay, let's go to our next question of the many submitted by viewers and readers. Who can donate plasma to help others fight the virus? Dr. Jill, would love to hear your thoughts and what you know about this one.
Yes, this is a really great question, Ralphie. So, in particular right now, as we're trying to look for different treatment options for individuals with severe disease. So if you have had proven COVID-19, meaning you've had the test that said you were positive, then you're going to be eligible to provide your plasma if you've been asymptomatic for 28 days, or if you've been asymptomatic for 14 days and a negative result of your COVID-19 follow-up testing. The idea behind this is if you need time to generate enough antibodies for the convalescent plasma that would be used to treat individuals to be effective. And at this point, I'd also like to point out, we're doing these trials, and these are being run throughout the country, throughout the world, to test if this convalescent plasma that has been donated by previous COVID-19 patients is going to be efficacious. And at this point, we don't know the answer to that. So these tests are being done. These large clinical trials are being evaluated to see if this plasma that's full of potential antibodies targeting the virus are going to be efficacious to treat particularly patients with very severe disease.
So Dr. Jill, that's a very interesting point that I just want to zero in on for a second, because there's certainly been a lot of talk about donating plasma. When you're doing so, you're really doing so more to help others study and learn more about this virus as opposed to directly help someone else, correct? That's kind of what I got from that answer there.
Well, it could be actually both. So clinical trials are used to test different treatment options to see if it will be beneficial and to see if it's safe. So in these clinical trials that are being done for convalescent plasma, where we're gathering plasma from people who have been previously infected, the hope is that it works, right? So we're giving it to people who have severe disease, and the hope is that it helps them get better. So yes, if it does help, then you're making a very big difference in terms of treatment. But if it doesn't, we're still getting information about how this virus is acting and what types of treatment options we have available. So it is important for people to donate plasma. I just want it to be very clear that we don't know quite yet if it's going to be successful or not.
Dr. Jill, thank you for that. Okay, let's go to our next question here. Can I get the virus twice? Adriana, what do we know about this?
Yeah, so talking about the virus, if you get the virus, it's presumed that you're going to have antibodies for that virus, right? So that's presumed that those antibodies will give you immunity. However, that hasn't been proven. I believe that the consensus among scientists right now is that, if you have antibodies right now, it's not proven that you have immunity to the virus so that you can't get it twice. However, I heard from this morning from our expert who talked to the editorial board that he believes that it will provide some sort of immunity, that there have been cases in North Korea and China of reinfection, quote unquote, but he believes that that reinfection is just a case of maybe like test miscalculation, inaccuracy, because that test maybe picked up the virus at one point, didn't pick it up, and then picked it up again. Maybe the virus, there had been so little inside the body that it was not able to be detected by the test. So right now, everything is very inconclusive, to say the least.
Dr. Jill, how are you as a medical professional processing all this ever-changing information about this virus? Because again, this question alone, we kind of thought we had an answer based on what we were hearing from some officials. Then that kind of changed. And now this morning, it kind of seems like, well, maybe the antibodies can build up and prevent this. So how are you processing all of this?
Yeah, this has been a very interesting couple of months being a physician scientist and trying to understand this virus. I think what's important for everyone to remember is we just learned about this virus. It's brand new. Just end of December, early January. And so the amount of work that's been done by our scientific community has been extraordinary. And the amount of information that we've gathered has been significant. The issue is that science takes time, and it needs robust studies to make sure that we're really teasing out what is fact and what is not fact. And while we're trying to race through this because we're in the middle of a pandemic, it's also critical that we're taking our time to really hold our scientific standards to the highest that we can, so we can answer these questions reliably and provide information to our greater community. So specifically with antibody production, it's very confusing. So there's evidence that you do produce antibodies. The question is how much antibody do you need? Are those antibodies going to be neutralizing, meaning able to kill and prevent infection? And if they are, how long you hold on to those antibodies over time? So there's so many questions, and this is evolving, as Adriana has been discussing, very quickly.
And Dr. Jill, another question that people are asking themselves, do I have the antibodies? And of course, that has led to antibody testing. Grace and Adriana wrote an article on this, which we'll link you to in the comments section. But Grace, where can I get an antibody test if I want one?
Yeah, so many people saw the news about that antibody study in New York that tested thousands of New Yorkers and was able to find that a high percentage actually were positive and had had the infection at some point. So many people were wondering, okay, can I get tested? You know, I thought this back in February or January and was never able to actually get a test. So can I, roll up to my CVS and get a test? And something Adriana and I really wanted to get across in that story is it's still limited, and we don't really have any validated tests yet. So like I was mentioning, we still have a lot of questions about how much of that antibody you need to have in order to be protected. Will that sterilize you so you cannot pass the virus on to someone else? So there are several small clinics that are offering antibody tests. So there's actually one about a mile south of where I live here in Chicago that started offering them last week. I stopped by on Friday and I went and I just talked to some people who are standing in line to ask them, hey, why do you want to get an antibody test? We don't know for sure yet that means that you're immune. We don't know if you can pass it on to someone else or not. And a lot of people said, I really wanted to know if I had it. That would mean to me, it would give me some peace of mind that if I were to get it again in the future, I know how bad it was. I know I survived, or I know my kid who has asthma didn't end up on a ventilator. But this specific test, it hadn't received FDA emergency use authorization, which is kind of a whole other ball of wax here, because there are some antibody tests that we're rolling out that have met the FDA emergency use authorization standards. So about a week ago, there were just 4 of them who had received that authorization. Now there are 8. The FDA recently approved a few more, but there are many tests out on the market right now, dozens of them, that have not received that FDA emergency use authorization, because in mid-March, the FDA updated its guidelines and said, hey, probably looking back on the pretty slow rollout of PCR tests, those initial diagnostic tests that would tell you whether you had the virus or not, and not wanting to repeat that error and wanting to make sure that people can have greater access to antibody tests. The FDA said, as long as you tell us that you are developing and marketing these tests, if you're able to validate it yourself, prove that it works, and you give us that information, and you market this test as saying not FDA authorized, then the FDA is essentially allowing that to happen. And so there are dozens of these tests that are now being offered at clinics. Many of these tests are also taking place at different universities or different hospitals that are conducting studies, but this is not widely available yet. And in places where it is available to the public, you should really be checking to see what test is actually being used here.
Right. Yeah, Adriana. So there's so much information there, right? And I know this isn't unprecedented with the FDA as far as allowing an unauthorized test to market. But Adriana, how do you know if the test that you're getting or where's maybe the best place to go to find a test that is actually authorized as opposed to one that's just kind of allowed onto the market?
Yeah, as you said before, the FDA, this isn't the first time the FDA has done something like this. It has created some confusion in the market, but it is a tried and true method of the FDA for epidemics in the past. I would say if you wanted to see what kind of test that they're using, if it's recommended, I would say one of the ones that the FDA has approved probably would be the best bet, right? Or at a university that is conducting tests, or some sort of institution that's well trusted.
Yeah, and just going off of that, Adriana, if you were able to find out which test was being offered at a clinic, say there's one in Greenville, South Carolina, and you wanted to know if that was one of the 8 that had been FDA emergency use authorized, you can just go to the FDA's website, and it actually has provided a breakdown of all the different tests that have received emergency use authorization. Now, that being said, even if it has received that, that's not a gold stamp of approval. There's still a lot of skepticism that you should weigh when considering that test, in addition to all those that have not even met that barrier.
Dr. Jill, Dr. Jill, I see you nodding your head there when Grace said that. Why were you nodding your head?
Yeah, I think what's really important to remember here is that serologic tests where we're detecting antibodies are very difficult to make upfront. So you have to have a lot of knowledge about the virus, how it behaves, and how it interacts with the immune response. And you need to know specifics about that virus to make sure that the test is sensitive enough. But at the same time, you need to make sure that it's specific enough to this virus that it doesn't cross-react to other viruses. So we have a host of endemic coronaviruses here that cause the common cold that some of these serologic tests can cross-react to. So there leads to false positive testing. And with these EUA authorizations from the FDA, they are truly authorizations and not necessarily approved. So they don't go through the same scrutiny that normal testing is required through the FDA. And in times of emergency and crisis, this is required, but we have to have our thinking caps on still when we're ordering these tests as physicians, and then as community members as we're interpreting these tests. And this is specified on the EUA website through FDA that these tests should not be used as sole diagnostic purposes and need to be corroborated with other testing and clinical assessments.
Still so much that we're working through here, especially when it comes to these antibody tests, which have been in the news a lot. You're watching Just the Facts Live Coronavirus Conversations. I'm Ralphie Aversa here in New York, and we're answering your most asked questions about the coronavirus pandemic. This next one is a two-parter. Grace, we'll have you give us the statistic on this, and then we'll find out exactly what that means from Dr. Jill. How long is an average patient on a ventilator?
Yeah, so we have, as you mentioned, there are several statistics for this, as far as how long people are on ventilators or how many people who are on ventilators survive. There are some small studies that have been conducted in the U.S., in China, in England, and we should treat them with some skepticism because they show that people can be on ventilators for short periods of time and many die. One of the most recent studies out of New York, it found that people between the ages of 18 to 65 had about a 70 to 80% mortality rate, whereas those above 65 had about a higher than a 90% mortality rate. But the problem is those were very small populations, and those numbers were only calculated about halfway through the study or so, when many people were still in the hospital and had not many more had actually remained on the ventilators. So overall, you can see studies suggesting that there are very high mortality rates on these ventilators. But again, those are preliminary, and many of these are not taking as quite a long-term scope as they could be to be getting the full picture.
Yeah, I mean, Dr. Jill, you just heard those numbers as well. They seem very high. What do you make of them? How can you kind of distill that for us?
Yeah, so first, we know that if you're requiring mechanical ventilation, intubation, mechanical ventilation for COVID-19, it means you have severe disease. So we know these individuals are very sick. They're not able to oxygenate their lungs well, and they're in a bad spot. So higher mortality rates that we were seeing in some of these earlier smaller studies where we're seeing 50 to 70% mortality in these individuals doesn't seem that far off. However, as you get larger studies, we're really going to be able to tease out what these actual rates are. So in this large study in New York, where there's 5,700 patients that were involved, as we were just mentioning, only half of the patients had actually been evaluated at the endpoint. So we're going to get a lot of information in the next couple of weeks in terms of how patients are handling mechanical ventilation and intubation, as well as what therapeutics are influencing the the rate of ventilation as well as how long someone needs to be on a ventilator. So these are important statistics that needs to be teased out. It certainly indicates severe disease, but that high rate of mortality is going to become more clear really where it stands as we have larger number studies.
So obviously, again, for those really that two-parter question that we just asked, how long is an average patient on a ventilator? And then once on a ventilator, what the survival rate is. Again, those are studies that we just need more information, basically, Dr. Jill, right?
That's exactly correct. And we'll get that information. And this study specifically in New York is going to have to follow up on these additional cases. And that's going to be a major indication of what's going on, specifically in an area so densely populated that had so many cases, to really give us an indication of the severity of the disease.
We're going to be wrapping up here in a few minutes. Thank you again for submitting your questions and for sharing this video as well, but we still have a few more to get to on Just the Facts Live. Let's go, Grace. How will I know when I'm cured?
Yeah, so we get this question a lot, mostly from people who are saying, I think I was exposed to someone who definitely had the virus, or I'm having symptoms and I think I had it. Some people have been able to get that initial diagnostic test that said, yes, you have it, you should stay home and self-isolate it. Some have. So the CDC kind of has two strains of guidelines here. So the general theory is go home, self-isolate or quarantine for 2 weeks. Isolate is if you actually you've been confirmed to have virus. Quarantine refers to when you suspect you have a virus or might have been exposed. So 2 ways out of this home isolation process. One is if you are going to be having a test to determine, again, if you're positive or negative. The other route would be if you're not going to be receiving a test. So if you are going to be receiving a test, the CDC suggests that you no longer have a fever, all your other symptoms have improved, and you should be able to receive 2 negative tests within 24 hours apart. If you meet all of those requirements, then you're good to discontinue isolation, but of course you should still be consistent with your state or locality stay-at-home orders. If you are not going to have a test, the CDC suggests that you have had no fever in the last 72 hours, your other symptoms have improved, and it's been at least 7 days since the onset of your symptoms. And all that information is available on cdc.gov. You can find that, but those are the 2 different options really for if you want to go back out.
So Grace, I just want to clarify, if you can't get a test after, if you have COVID-19, you go the 14 days of self-isolation, the CDC is basically saying another 3 days, another 72 hours with no symptoms, and then you're okay to go back out.
At least, yes.
At least, okay.
Again, there was that other small caveat at the end there that it should be at least 7 days since the onset of your symptoms. So it's possible it could be shorter than 2 weeks. In most cases, it's not. Most people with moderate COVID-19, they have symptoms for about 2 weeks, so they're sick for about 2 weeks. But yes, at least 72 hours, no fever, and your symptoms are getting better.
Let's go to our last question. It may be the biggest one. I think it's the one that is on, quite frankly, everyone's mind. Dr. Jill, as someone who works in a couple different professional fields, health fields, but also has family and friends that are probably asking this question, I'm curious to what your answer is. How will we know when it's okay to go back to normal?
Yeah, this is a great question, and one that's on, as you mentioned, everybody's mind. So what I first like to tell both my patients, my family, my friends is we won't and we shouldn't go back to our previous normal. This doesn't mean we don't go back to our normal activities, we don't go back to our jobs. That will come certainly with time. But keep in mind, we've seen 3 outbreaks of coronavirus in the last 20 years with SARS-1, MERS, and now SARS-CoV-2. We've seen Zika, we've seen reemerging Ebola. So we're seeing these emerging and reemerging conditions that are infecting our population. So we definitely need to change our mindset about the importance of public health infrastructure and how we conduct ourselves within our community. Based on that, there are some things I want to see before we get back to all those normal activities. And these are outlined really nicely in a document by the World Health Organization, as well as in other public health organizations as well. But you want to be able to see decline in cases, that you have an infrastructure where cases can, 1, be detected, that case can be isolated, and then contact tracing, meaning going out and finding other people that this person who is positive has been in contact with, quarantining those patients so that we are on top of any potential clustering or outbreaks that might happen. And this is incredibly important moving forward to prevent second waves, tertiary waves of infection. We also need to know more about antibodies, as we've been talking about this past half hour. Do we get herd immunity? Do we get long-lasting immunity? These are questions that will have huge public health implications moving forward that we just don't know currently. And then, of course, investing in our therapeutics, both post-exposure prophylaxis, meaning if you've been close to somebody and they're sick, that you could take a medication to try and prevent illness. And those studies are being done across the United States, as well as our vaccine development programs. So really putting emphasis on rolling these vaccine programs out in a safe and efficacious manner. When we have these pieces in place, we'll feel much more confident telling people to go back to their normal activities, and with, of course, that caveat that we need to keep a public health infrastructure and emphasis in the back of our minds.
Is it safe to say, Dr. Jill, that when we go back to normal, it's going to be a new normal?
That's exactly what I mean. Yes, I think it's really going to have to be everyone as a community working together to understand that these outbreaks can happen, and it potentially will happen in the future given the history we've had over the past 20 years, and that we all need to be prepared for these types of outbreaks in the future so that the infrastructure is in place to test and isolate, and that we have the infrastructure in place to develop new tests and new vaccines quickly.
Grace, Adriana, what are you hearing, I guess, on a local level, whether it's the federal or state level, about this returning to a normal or, of course, a new normal?
Yeah, I mean, talking to our expert for Johns Hopkins early this morning with the editorial board, we had talked about what that would look like if there was any chance of getting to 0 cases in the United States. And basically the general consensus is the United States is really large. I don't think we're going to be able to get to 0 cases until we have a vaccine. Public discussions have said that that would be from 12 to 18 months just to develop the vaccine. And then to manufacture and distribute at such a wide scale is going to be a huge, lift. So basically what we're saying is, there's going to be a pandemic around for a while, and to tolerate the sort of cases that are going to be around, and states need to sort of decide how they want to be able to mitigate that with different measures, depending on whether it's social distancing measures, intermittent social distancing measures. Maybe certain things are going to be open and other things won't. Maybe just outside things will be open, and certain events like concerts or something like that won't. So it's definitely going to be different. It's definitely not going to be right back to normal, but it's going to be something.
Let's hope. Let's
just,
all hope.
If we have time, Ralphie, just going off of that, Adriana, I think it's helpful to see what's been happening in Georgia and states that are slowly starting to reopen, and to see how much we can return to normal and where we have to walk that back a little bit. I've been talking to business owners, and some are saying, we're not going to open anytime soon, and others are booming and having a great business. So that there's some semblance of normal emerging there, but we have to watch and be careful and see what happens if there is a rebound of cases or another wave.
Staying vigilant, staying informed. That's what we're trying to do here and able to do, thanks to Grace, Adriana, and Dr. Jill. Thank you all so much for joining us. This was highly informative. And thank you for tuning in to Just the Facts Live Coronavirus Conversations. You can follow along more of the COVID-19 pandemic coverage at usatoday.com. You could also follow us right here on Facebook or on Instagram at USA Today. Our next Just the Facts Live Coronavirus Conversations will be next Tuesday, May 5th, Cinco de Mayo, at 2 o'clock. In New York, I'm Ralphie Aversa. Thank you for tuning in. Have a great day.
Hey, thanks for watching. If you like this video, check out these other videos from USA Today to stay up to date with all the latest news.